Hello, Angela.
Hello, Marion.
How's it going?
It's amazing. What's going on with you?
Well, I am super excited, and I'm going to tell you why. We are doing something different this week for our special COVID-19 episode of Amplify Nursing. We are coordinating coverage with another local podcast put out by the Pennsylvania Action Coalition. So their podcast is At the Core of Care, and it highlights consumer experiences of patients, families, and communities, and the creative efforts of nurses.
Yes, this is fantastic. Their episode, Refugee Health Up Close, is going to pair really nicely with the interview that we did with Dr. Laura Vargas and Dr. Adriana Perez from the School of Nursing, who both study Latinx immigrant health. It gives a really broad perspective on the topic.
Yeah, so I would highly encourage folks, if you want to learn more about these important topics, to check out their podcast at paactioncoalition.org or subscribe to their podcast on Apple Podcasts or wherever you get your podcasts.
Hello, everyone. I'm Angela Rosa Donato.
And I'm Marion Leary.
And you're listening to Amplify Nursing, a Penn Nursing podcast supported by the Pinola Fund for Innovation in Nursing.
Amplify Nursing features nurses who are leading the way in science, policy, and innovation.
Our guests defy stereotypes, define practice, and disrupt convention.
We highlight the breadth and depth of nursing influence on society by amplifying nurses who are pushing boundaries and breaking down barriers to build a new paradigm. Today on Amplify Nursing, we talk with Dr. Laura Vargas and Dr. Adriana Perez, two scholars whose research focuses on Latinx immigrant populations in the U.S. Dr. Vargas is a Vice Provost postdoctoral fellow at the Penn Injury Center at the University of Pennsylvania School of Nursing, and Dr. Perez is a nurse practitioner and an assistant professor also at the University of Pennsylvania School of Nursing. We discuss the challenges our immigrant communities are facing during this pandemic, how health and healthcare disparities in the Latinx immigrant communities are being magnified, and what needs to happen moving forward to start to solve for these complex issues both during and after the pandemic.
Dr. Perez and Dr. Vargas, thank you so much for coming to speak with us today.
Thank you so much for the invitation. It's a pleasure to be with you and with my good friend, Dr. Perez.
Yes, likewise. I'm so excited to join all of you. And like Laura said, we actually do some work together. So this is a great opportunity to join her.
So Dr. Perez, why don't you start by telling us a little bit about the population that you study?
Yes. In general, my area of interest is healthy aging in older Latinos. And that includes all of us. I mean, we are all aging. So I look at vulnerable populations like farm workers, those that are migrant and immigrant, and those that have been here for generations and are aging in place. I am interested in the aging process, both looking at challenges and strengths in the population.
And Dr. Vargas, how about you? What population are you looking at?
Well, my research has focused mostly on recent Latino immigrants, and I focus on how exposure to trauma, violence, and other specific forms of trauma impacts mental health symptoms, specifically depression and anxiety, among recent Latino immigrants. So I look at the entire migration period, if you will. So before people leave their home country, while they're traveling to get to the United States, and immediately after arrival to the United States. So the focus is to understand what those trajectories of exposure to trauma and mental health look like.
Dr. Perez, can you tell us a little bit about some of the differences between the populations that you're studying? So farm workers, both migrant and immigrant farm workers, and then also older Latinos that have been here for a long time who are aging in place.
In my research, and I came from Arizona, which is a border state, and I was a Southwest Borderland Scholar at Arizona State University, and the immigrant population there and the farm worker population is predominantly Mexican, and their way of life is coming back and forth across the border every day to work in the fields. In fact, I come from a family of farm workers, and I was very interested in the migration of Latinos for farming and other industries to the rest of the U.S. To my surprise, I have found that there indeed are many Latinos from all over Latin America in the East Coast and in Pennsylvania in particular because of the mushroom farm work. So my interest in research is to look at, track the health overall of farm workers. Farm workers tend to be younger, similar to the rest of the Latino population. However, they're not experiencing aging like other Americans. For example, farm workers on average have a life expectancy of 51, 52 years old. So they don't benefit from research advances that ensure all Americans live longer, healthier lives. And to me, that is a big concern. As you know, farm workers are responsible and really help to feed the nation. They're responsible for the food that we eat. So if you enjoy vegetables, meat, dairy, all those things, I mean, those things are because of immigrant workers in this country. So in my interest as a nurse, I really want to know how to best advance the health of farm workers. In addition to the challenge of language, they also don't have, for the most part, access to health insurance coverage. And even when they do, they're in a system that really is not designed for them. Very few healthcare providers speak Spanish. And again, I think coming to Pennsylvania has really underscored the need for ensuring that our workforce mirrors our country. And here in Pennsylvania, I've also learned that farm workers come from many different places in Central and South Central America. So in addition to having language barriers, we're finding that some have different dialects in addition to Spanish. So providing health information, whether it's related to COVID or other health issues, is also challenging, but at the same time very much needed. The resources that often healthcare providers have, as well-intentioned as they think we try to be, really fail to reach those that are most vulnerable. And again, those that are vulnerable but yet are essential to the health of our country. I'm interested in their health overall, tracking things like nutrition, sleep, physical activity, all the pillars of health that we promote in general to the American public, again, don't often reach this vulnerable community. Thankfully, other areas of research have been addressed a little bit more, and I would say with a lot more success, like the issue of environmental factors and how they impact farm workers. But like I said, compared to the rest of the Latino population, they also experience high rates of hypertension, diabetes, depression, and so many other chronic conditions. So I'm very interested in their health and studying their health and developing interventions that are not only linguistically relevant, but those that mirror their values and their priorities. And then second is aging, period. I have found that even Latinos that have been here for generations still face many of the same challenges that newly immigrated Latinos face when it comes to discrimination, racism, and a lack of inclusion when it comes to health care decision making. Often, they're not involved in their plan of care, and they don't really, their goals, I would say, and I'm a nurse practitioner as well, I think that while we are trained to address disease and look at different lab values and diagnostics, often their health goals are a lot different than that. And working towards the development of interventions that include them in that, in the design of interventions that take into account, again, their not just their challenges, but also their strengths. And I would say that something that cuts across immigrants, Latino immigrants, whether, again, newly immigrated or those that have been here generations, is that there is a lot of inherent strength that comes from being an immigrant. Some of it is, being resilient, because often they have no choice but to be resilient, and that is a strength. And secondly, a strength of having a close-knit family. Familismo as a concept has been found to be a protective mechanism for health, and yet, I get so worked up because of the discrimination that they face.
I can't imagine the amount of strength it takes to pick your entire life up and move to a place that you don't know anyone, that you don't have support, that you don't understand the language, that you don't understand how it all works. And in this political climate, it's hostile. So I can't even begin to imagine what it must be like to have to make that decision and know that it's a better decision than staying where you are. I applaud your efforts to take care of and look at this population of people. My grandmother is Puerto Rican, and she never complains about anything. She never says a word about anything. I think that's also part of the culture. It's not like a whiny, complaining culture either. So no one, they're not advocating for themselves. And I think it's incredibly important that we as nurses advocate for vulnerable populations.
Thank you for picking up on that, Angela. Just to, kind of close the loop here. I think as a researcher, as a scientist and as a nurse practitioner, what I have learned all these years is that, and it's, again, validated by my work here in Philadelphia when I think about, my work in Arizona, and that is that, while we're trained to look at problems, disease, issues, we really miss the big picture when we don't study resilience, social support, the inherent strengths of the community. Here in North Philadelphia, for example, there is an amazing coalition of Latino leaders that care for their elders. And despite being under-resourced and understudied, they have really pulled together during this time of COVID to ensure that older adults are taken care of. And, as it is with many Latino subcultures, we revere our elders. And it's really a strength that I think we need to leverage as scientists and as clinicians.
Yeah, I totally agree. So why don't we talk a little bit about some of the challenges that COVID-19 has brought to these immigrant communities. Dr. Vargas, why don't you tell us a little bit about what you're seeing?
Thank you. Yes. Well, I've been focusing on a particular community out in Montgomery County, where I've partnered with a community organization called Secate, and they have, a number of families that are affiliated with it's a nonprofit that is it promotes culture, it promotes art, promotes education, so it has all sorts of workshops for both children and adults, and they're keeping those workshops going even in COVID, so people are online. They're doing all this through Zoom. So we've had a chance to talk to the folks out in that community, and of course the biggest challenge is losing their employment, right? So, and losing a steady source of income. That makes these families not just job insecure, but in a not so long term, they're food insecure. They are at risk for obviously health and not being able to access health care. their children are out of school. Many do not have access to reliable internet or access to a device, a tablet, or a laptop for their kids to continue their work. Luckily, this community has come together to make sure that the kids that have to do their schoolwork online are able to do so. So the immediate impacts have to do with all of those things. But that's kind of the, if you look at jobs, education, and health, an important impact is that they are very concerned about, getting the disease and coming home to their families and contagion. So this is a big concern because many don't have, as Adriana said, access to health insurance or even health care. They are not, the system is not designed for them, as Adriana said. And in addition, I think that we take for granted the capacity that people have in this country. Maybe people who are from the United States have always felt entitled to certain services in the United States and are able to advocate for themselves, as you say. Culturally, as you mentioned, lack of infrastructure for healthcare and other resources, perhaps in their home country, hasn't led to a lot of this self-advocacy. And particularly when you're here, that's also reinforced by the hostile environment that you mentioned. So that's a big complication. So getting sick and going to the hospital is an absolute last choice for a lot of these folks because they don't want to get sick and because many of them are undocumented and they're scared. They feel that if they come into an interaction with an agency or a public agency, that might lead to deportation or some other punitive measure. So on that end, there's that constant fear. Another, I think, important thing is that, as Adriana said, there is a lot of resiliency and inherent strengths in the community, such as resiliency and familismo. Many of these families are now together, but they are also together without being able to provide properly for their children. So the pressure, I think, that a lot of parents feel is really big, and they do not see how the crisis will come to an end soon. They don't know what will happen. There's a really great sense of uncertainty. And in addition to that, I mean, a lot of the folks that I've spoken to, there's a great also sense of belief and faith. So there's a great sense of faith in that things will improve, things will get better. And so I think that that's another strength of this community. And the other thing that I have observed more generally among Latino communities, but particularly during this time, Latinos have a very strong, or Latinx communities have a very strong sense of solidarity. Maybe it comes from the familismo, maybe it comes from, this extended, larger concept of a family. Your neighbors sometimes are your family because you have compadres and you have, so the circle gets extended and there's a sense of solidarity that I feel that Latinx communities have very strongly internalized as one of their core values.
Have you seen I'm sorry, go ahead, Laura.
Can I add something about access to testing? This is important.
You may.
Thank you. So in a lot of Latinx communities, as Adriana said, there's a barrier in language, and therefore there's always a delay in information reaching members of the Latinx community, right? So for example, getting to a drive-through test center is a complicated thing because, number one, not many families will have a car to get there. Number two, they might not receive that information until much later. Similarly, when people rushed to supermarkets, say to buy toilet paper, well, the last folks to find out that they need to rush to the supermarket, if that was what they needed to do, were the Latinx community. So by the time they reach the resources that they need, those resources are very scarce or exhausted completely. So there is a big problem with getting information to folks and getting testing available to these communities. Most of the testing centers, they're making an effort in the region that I've been working with this community. They're making an effort to bring testing centers to mostly minority and disadvantaged communities, but the efforts haven't been fast enough or wide enough for people to get information on where to get tested. And also, again, the factor of fear of coming into interaction with any kind of agency, be it a health agency. People need to trust that agency. And so building trust is a really important part of responding to the COVID-19 challenges in the Latinx community.
Thank you. No, because I think this is important. I think Dr. Vargas outlined some very important and real issues with COVID, but I think it's very important for us to discuss the inequities in terms of rates. Early reports are showing from the CDC and elsewhere in states like New York City and Chicago, higher rates of COVID-19 incidents and health challenges in Latinos and other minorities, but also underscoring the fact that most minority populations, immigrants included, are in these frontline jobs and unfortunately do not benefit from any of the relief, economic or health relief that has been issued through current legislation. So immigrants do not have the benefit of getting any kind of economic relief. They might not have health care, so there's no resources for testing. In the case of farm workers, many live in close quarters and they live in poverty and, as Dr. Vargas said, experience food insecurity. So many, the barriers working against immigrants staying healthy and being able to just meet the minimum of what is needed to have a decent living wage and fair opportunity for health.
And adding to what Dr. Adriana just said, it's also really important to consider along the lines of the CARES Act that was passed and other legislation that has been passed for larger relief of the population. Latinx communities are mostly not eligible if they are undocumented. But there are also some other clauses in the CARES Act that, for example, families who have one person who is undocumented or in the process of getting a green card or is not already a regularized citizen or resident of the United States, even in those families, access to relief from the CARES Act is not available. Similarly, when one thinks of the PPP program, which was meant to provide loans, it's the payment protection plan, I believe, to provide loans for small businesses, etc. It's not just Latinx communities being left out. It's all communities of minorities, minority origins, particularly African American and Latinx communities. Many, for example, in the Latinx community don't have, they employ several people, they have a company set up, they pay taxes, etc., but they are not eligible to apply for the loans, maybe because they don't bank with a large institution. So that the requirements along the lines of the PPP program are also presenting significant challenges, even for those in the Latinx communities who are employers, entrepreneurs, and small business owners.
You know, all of these things that you've brought up have been challenges for everyone, and therefore it's almost like even more exclusionary.
Yeah, it does have a crowding out effect when you have such a large impact on the larger, broader population.
Mm-hmm.
Those folks who have traditionally been able to access services in the past or have been able to file for unemployment, of course, they will be able to try to apply to get the relief, and rightly so. Everybody needs it. The challenge is to begin to think about populations that are excluded from the normal system under normal circumstances, and think about how there might be policy solutions that can be more inclusive of those populations. And it doesn't merely just stop at folks who are undocumented. There are other populations, elderly populations that Adriana studies, who are just not don't have the right tools, they don't have the right knowledge, information, capacity even to access the relief. So it becomes when so many people are impacted, it becomes what they call a crowding out effect, right? So people just come to the program immediately, and eventually people get left out because so many people are coming to seek that relief.
Even though there's been difficulty getting testing and such to the Latinx communities, are we seeing higher rates of infection and mortality among this population?
Well, I can speak that the preliminary numbers point towards, yes, higher levels of contagion and mortality, particularly among African American and Latinx communities. From New York City, we know the data has been particularly devastating for these communities. But I mean, also anecdotally, there are a number of ways in which, we might want to consider in the long term what the numbers reveal. So, for example, in this community that I'm working with, it's the number of people who are sick or have a family member who is sick and does not want to go to a hospital, does not want to see a doctor, is writing it out unless it gets, unless their symptoms are really, really bad, or even folks who are told that they should come to seek care when their symptoms are very extreme. That's a population that's unobserved until their cases become very extreme, or there's mortality in these populations. And more likely than not, the mortality is going to impact those regions or those populations that are going to have higher chronic conditions, higher levels of chronic conditions, et cetera, that are risk factors, right? So,
right.
Adriana, I don't know if you want to add to that.
I do want to share some data from the CDC that was released this week on racial ethnic data that's showing provisional death counts. Now, keep in mind, as Dr. Vargas said, I think we have yet to know the numbers and what they truly are. But what I like from these numbers is that the CDC is weighting population distributions. So the distributions ensure that population estimates and percentage of COVID-19 COVID-19 deaths represent comparable geographic areas, so that we're taking into account rurality versus, urban areas. And so this data, I think, will be a little more complete and continues to be, further, it will be more comprehensive. But to give you an example, in terms of state by state, in Arizona, my home state, while the Latinx population is 31.6%, those that have been impacted by COVID-19 that number is about 31.9% when weighted for geographic outbreak areas. And Arizona is very spread out. It includes a very dynamic border community. So that shows that death rate is up, meeting sort of the rest of the population, Latinx population in Arizona. Here in Pennsylvania, while the Latinx population is about 8%, those that have been impacted by COVID-19 are estimated to be about 11.1% when weighted for geographic outbreak areas. In states like New York, where the population is about 12%, 11.7%, those Latinos impacted are about 18.7%, so exceeding the current population. And again, I think we're going to see these numbers continue to change as more become tested, and as I think the numbers, reveal that especially those that have other pre-existing conditions show that they are even more at risk because of things like diabetes, heart disease, asthma, and things and those other, healthcare comorbidities.
And how about your seniors who are aging in place? What are some of I can imagine there's been a lot of difficulty in reaching them, considering everyone's supposed to be social distancing and things like that. How are you getting around those challenges?
Yes, that's right. So my research here is in North Philadelphia. I've learned that older Latinos reside predominantly in North Philadelphia, whereas the South Philadelphia community tends to be the younger Latinx community. And what I study it's interesting because I look at environmental factors, things like crime, neighborhood noise, neighborhood density, socioeconomic status as measured by home value. The North Philadelphia community experiences much higher rates of crime compared to other communities, higher rates of poverty, noise level, and density. So there are these challenges, and in addition, while you see on television and sort of the experts recommending to go outside for a walk, you can certainly go outside, you can bike if you need to, use the trail. That's not a reality in the community. It's a very dense community. So my older participants and even those that I see in clinic have less opportunities for walking, sidewalking, access to green spaces, for example. And what we're finding is that, I think, Dr. Vargas, you mentioned, they do not have access as readily available compared to other older adults when it comes to technology. In fact, learning now that it's a struggle to reach them via telemedicine or other technologies like smartphones. They have phones, but maybe not smartphones. And for the most part, they, at the very least, are experiencing mild cognitive impairment, and at the most, severe cases have Alzheimer's because they're at risk for Alzheimer's and other dementias. So they need a lot of support, assistance, navigating any kind of technology. And so that, that becomes even more pronounced as an issue during a time when they're supposed to be socially distanced or physically distanced. And so that is a big concern. There's a growing number that need assistance in the home, from families to aid assistance through Medicare, Medicaid. But that in itself also puts them at risk for either isolation, which is could be a huge social and health problem in older adults, and at the same time, they're exposed to people that are in the front lines, seeing others, in occupations where they themselves are at high risk. So again, I also, tend to look at how can I leverage the strengths that they have, and I still do think that things like the faith-based community, which is very solid and very strong in North Philadelphia. In fact, the Archdiocese issued in the last couple of weeks some additional assistance for families with seniors, for housing, for food, and other resources. So I have been so heartened to see that, and to see the community, whether from the private sector, the faith-based community, and local leaders pulling together to do the best they can when it comes to protecting seniors.
If I may add to that point, that's a really important point that Dr. Adriana makes. Since many Latinx communities are also multi-generational within their households, they also are multi-generational across borders. And one important aspect of this is that on the mental health side, people are worried about particularly older generations in their home country. Immigrants are worried about parents, they're worried about uncles, they're worried about, and so therefore there's a sense of wanting to do more, but not being able to do so, number one. And number two, just the economic impact has big reverberations for that multi-generation family across borders, because immigrants have less income here, and they're not able to send as much money in remittances. So, and remittances, at least in Mexico, it's I believe it's the third source of income to GDP of the country. It's the oil, tourism, and remittances from the United States. So it's a really big economic impact that reverberates across borders. And when economic situations get worse in the home countries, you add that to a global pandemic, and perhaps fewer resources and less capacity to deal with a really widespread contagion of COVID-19. It's almost like a multiplier effect that affects families across generations and across borders.
So what do the two of you think are some of the things that we need to see moving forward as we come out of this pandemic, eventually, hopefully?
Well, number one, I think something that you're hearing from all of the issues that we're describing is sort of the elephant in the room, which is we need immigration reform. We need to be able to count and include immigrants in all aspects. And I think that until we do have comprehensive immigration reform, these issues will not be solved. These are complex issues. And when you have a population that experiences fear every day to go to work, to go to the store, to access healthcare or any other resource, that will really determine their health, and I think the health of our community, because regardless of how you feel about immigrants in this country, we will see them in the emergency room, in the school system. As Dr. Vargas mentioned, I think many, at least colleagues that I know, still are surprised to learn that there are these mixed status families that have children that are U.S. born American citizens, and yet, their families still live in fear. We have 800,000 dreamers waiting to learn their fate. Many, and I have colleagues that are nurses that are DACA recipients, and I think it has to start there with immigration policy, not being politicized, but truly being comprehensive and moving forward.
Yeah, just to add to that point by Dr. Perez, well, there's a really great op-ed written by a journalist who covers the U.S.-Mexico border. His name is Alfredo Corchado. He writes this op-ed in the New York Times, which I believe came out yesterday, where the title is that if they're essential, they can't be illegal. As Doctora Perez mentioned, a lot of the folks who are keeping the lettuce and all of the agricultural products on shelves in supermarkets, it's a labor force of over 1 million people, it's the estimate, are folks who are undocumented. And those are frontline workers who are also falling sick, and many are afraid to contract the virus and therefore will be out of work, etc. So it has big repercussions for food security, generally speaking. But going back to what you were talking about in terms of solutions, I believe that there are solutions that are applicable to the broader population, as we've mentioned, access to PPP loans, access to these immediate inclusion of financial benefits to families, regardless of their documentation status. And there's precedent for that in the state of California. They had a relief package for all of their citizens. I believe it was a transfer of about $500 per citizen, regardless of their immigration status. So that's the things that apply to everybody also apply to Latinos and Latinx communities. What's important to keep in mind is that Latinx communities are even more vulnerable in terms of their preparedness to deal with something so large of a hit as a pandemic would be. And they also don't have that safety net or have less of access, less access to a safety net. For example, a solution that's important is that a solution that could be considered is expanding. For example, a solution that applies to everybody would be expanding moratoriums, not just on mortgages, but also on rent, right? That applies to everybody. But you can make that more specific as well to include the Latinx community, saying there's a moratorium for X amount of time, regardless of your documentation status, right? So the add-ons need to be very specific to include the populations that are excluded. More specifically, for example, in Montgomery County or in Pennsylvania, PPP funds are accessible through specific bank branches, and the SBA, the Small Business, I believe it's Administration Office, has offices, regional offices everywhere in the country. However, not a lot of those resources are available in Spanish, or maybe many of those locations don't have people who can provide expertise and guidance to people applying for PPP loans in Spanish, and helping them gather the necessary documentation, etc. So again, there's an example of how we can make solutions more expansive to include the people who are excluded normally. Since I focus on mental health, a really important service has become telehealth. And I think that telehealth is actually very efficient for reaching Latinx communities, in the sense that many people are afraid because of their legal status or for other reasons to go to a health center. But if they're available, if they can access services through telehealth, there might be a larger inclusion and a larger demand among Latinx communities, particularly for services in mental health, or even in, we've seen it in primary care, but mental health is really important. And this one applies to the Latinx community in terms of offering services in Spanish, and also offering information in Spanish through trusted community organizations, trusted community leaders. So the rollout of the public health efforts, policies, programs need to partner with communities in the Latinx regions and among the Latinx population. So I think that, investments, generally speaking, in staff and personnel, just like we want to invest in contact tracing, general investments for health organizations to also have people who can do this more specific work of community outreach to populations that are normally excluded, Latinx, older populations, for example, becomes a really, really important tool for local healthcare centers to leverage in making care accessible to the people who need it the most. Finally, I think that and then here again, there's an incentive. A larger solution is for employers to hire, obviously bring back employees and hire employees, but that they do so under safe conditions, right? And also, one can think about how those incentives might be expanded to businesses that provide jobs for folks who may not have the proper documentation, or folks who are owners, businesses, foreign-born employers, to be included in that larger effort of both safety and economic revival. As Adriana, as Doctora Perez said, there are steps that can be taken towards a larger immigration reform. So specifically, there are states and there are cities where, for example, you can have a driver's license regardless of your documentation status. What does that do? Well, if you have a driver's license, you can open a bank account more easily. You can have, and through that bank account, you can have access to the services that banking institution provides. And so the access, it's a point of entry to a larger system of access to both services, care, schooling, etc. So there are steps, as Doctora Perez mentioned. There's steps to include dreamers, there's steps to include farm workers, and all of those things should be on the table, particularly as we have seen how much our country relies on the labor, the taxes, the contributions, the innovation that immigrants and specifically Latinx immigrants bring to our country, our communities, our neighborhoods, etc. Oh, and an important thing, one last thing I think that is really important is to think about along the lines of, for example, providing licenses. One can speak to accepting, for example, the Consulate of Mexico provides a consular ID to all Mexican citizens if they want one. Maybe accepting the consular ID as an official document of identification is a step towards, once again, this access towards larger services. And a really, really important part of this is to stop deportation proceedings, to, put a hiatus to this persecution in the midst of something so impactful that we haven't seen in our lifetimes, such as a pandemic. It just seems like the right thing to do, that regardless of how you begin to work through immigration proceedings, that deportations need to at least be put on hold, because we rely on a lot of these folks for our food supplies, for our labor, etc. So I think that would be an important step and an important olive branch, really, for Latinx communities, and an important signal for a lot of Latinx communities to begin to build that relationship of trust with these communities.
Dr. DiDonato, I do want to at least end with resources where listeners can go to learn more. And there are some really great resources out there that are interprofessional, interdisciplinary. One that I look for, obviously, we know are federal resources, but Salud America has put out some really great infographics on various issues related to immigrant health, Latinx health. And one of the recent articles is about 19 ways to ensure health equity in regards to immigrants, Latinos in the country. One I want to pick because it's timely, and it has to do with the census. As you know, the census officially started. Latinx communities have historically been undercounted in the census. Currently, there are efforts to reach the Latinx community in very unique ways. Here in Pennsylvania, Lehigh Valley, there's a campaign targeting Latinx households that traditionally are hard to count. So yes, having information that is in Spanish, but also finding creative ways to reach the community through trusted sources like the faith-based community, etc. So that's very important, and I think that this will contribute greatly to addressing health equity for immigrant populations. We need campaigns like these, like Hágase Contar is the campaign. So I encourage your listeners to look at organizations like saludamerica.org for more information.
That's excellent. Thank you both. Thank you both for coming on and speaking with us today. And I applaud the work that you're doing. It's so incredibly important and so necessary. And thank you very much for coming on. Amplify Nursing is hosted by Dr. Angela Rosa DiDonato and Marion Leary, and produced by the University of Pennsylvania School of Nursing, with special thanks to our Department of Information Technology Services for their assistance. Music for the podcast was created by Harper Leary. The podcast is made possible by the Krista and Rich Pinola Fund for Innovation in Nursing.
Follow us on Twitter at Penn Nursing. Until next time, keep pushing over, under, around, and through. We want to thank you for listening to the Amplify Nursing podcast and remind you to subscribe to the podcast on iTunes, Google Play, Spotify, or wherever you enjoy your podcast listening. And if you can, please do us a solid and rate and review us as well. It will go a long way in amplifying our episodes.